Hello everyone, this is Dr. Sangeeta Chaudhary, and once again I welcome every viewer to my channel. In my today's discussion, I am going to talk about the infection dengue. Dengue is a very well-known name or well-known infection to everybody. So let's know about dengue, how dengue spreads, what are the symptoms and signs of dengue, how it is diagnosed, and how we can manage a case of dengue. Dengue is a viral infection, but sometimes it can become very severe, which may be fatal also. That means it can lead to death also in complicated cases. So it is very important that we know about dengue, how to prevent it and how to treat it. What is the organism which causes dengue? It is arbovirus. It belongs to arbovirus family and genus is flavivirus. Dengue virus has 4 serotypes: 1, 2, 3 and 4. Infection with any particular serotype, it will provide lifelong immunity to that particular serotype. Okay, that means if somebody is infected with serotype 1, then that patient will develop antibodies to serotype 1. But mind it will not prevent infection by other serotypes. Okay. What is the vector for the disease? The vector is a mosquito, that is Aedes aegypti. So bite by an infected Aedes aegypti mosquito results in dengue infection. Now let's know about the pathogenesis of dengue. What happens and what it causes. Incubation period is 4 to 6 days. It may range from 3 to 14 days. Okay. Arbovirus, it infects macrocytes and monocytes. It is the central of the pathogenesis. And there will be leakage of plasma into extravascular space. It results in dengue hemorrhagic fever, or it may lead to dengue shock syndrome. So these are the complications of dengue infection which I am going to discuss later on. Manifestations of dengue, it occurs due to the complement activation, due to cytokines and other mediators, which ultimately facilitates plasma leakage. Okay, plasma gets leaked from the intravascular to the extravascular space, resulting in shock, and there may also be coagulopathy. So this is about the pathogenesis of dengue, how it infects a person. Okay, and after a certain incubation period, there will be manifestation of symptoms. Now, if we look at the pathophysiology through a flow diagram, once a person is infected with dengue, a particular serotype, there will be formation of antibody against that particular serotype. If the same person gets reinfected with the other serotype of dengue virus, then there will be augmentation of virus multiplication. It will lead to increased vascular permeability, resulting in plasma leakage from intravascular to extravascular space, which will result in hypovolemia, in turn leading to shock, and if the patient is not treated, remains untreated, it may lead to death of the patient. Okay, there will be also reduction in the platelet count, which will result in coagulopathy, and there will be disseminated intravascular coagulation, which is also known as DIC, which is a very severe and serious complication which leads to severe bleeding, and ultimately if the patient remains unattended, the patient may die also. So this is about the pathophysiology in short. Coming to the important portion, that is clinical manifestation. Dengue infection can manifest in 3 ways. One is classical dengue fever, which is also known as break bone fever. Why break bone? Because the patient will have severe pain in the bone, as if it is like the pain of breaking a bone. Okay, so break bone fever, which is the classical dengue. Then the patient may present with dengue hemorrhagic fever, which is one of the complication, or the patient may present with dengue shock syndrome, which is one more dreaded complication of dengue. So these are the 3 variety of manifestation with which a patient may present to us. Now what happens once there is dengue virus infection? The person may remain asymptomatic. It is not that everybody will be symptomatic. Okay, so the infection may not lead to the disease. The patient may remain asymptomatic. If the patient becomes symptomatic, there may be few manifestations. It may result in an undifferentiated fever like any other viral infection, okay, which is not very specific kind, not very specific clinical manifestations will be there. Other than that, there may be dengue fever without hemorrhage or with hemorrhage. If it is with hemorrhage, it is known as dengue fever with hemorrhage. And the other one is plasma leak syndrome or dengue hemorrhagic fever. Dengue hemorrhagic fever may be associated with shock, which is known as dengue shock syndrome, DSS. It may not be associated with shock also. So these are the symptomatic cases of dengue where the patient may present with undifferentiated fever. Okay, patient may present with dengue fever without hemorrhage or with hemorrhage, or dengue hemorrhagic fever or plasma leak syndrome without any shock or with shock. It will be known as dengue shock syndrome. So this is about the variety of clinical manifestation of dengue infection. Now there is a new classification criteria of dengue by World Health Organization. So the classification says the dengue may be non-severe without warning sign. It may be a severe case of dengue with warning signs and severe dengue. Okay, so non-severe dengue without warning signs. Okay, how we know it? Okay, probable dengue if the patient lives in a endemic area or patient is traveling to an endemic area. Patient is having fever and two of the following criteria. Two of the following means nausea, vomiting, rash, aches and pains, tourniquet test positive. I'm going to describe what is a tourniquet test, leukopenia and without any warning sign. So if the patient is living in or traveling to an endemic area and patient has fever with two of the following manifestations without any warning signs, then it will be considered as non-severe dengue without warning signs. Now next is non-severe dengue with warning signs. So what are the warning signs? Okay, the warning signs may be abdominal pain or tenderness, persistent vomiting, clinical fluid accumulation because of extravasation of fluid from plasma, from intravascular to extravascular space. There may be mucosal bleed. Patient may have lethargy, restlessness, liver enlargement by more than 2 cm, and lab finding there will be increase in hematocrit concurrent with rapid decrease in platelet count. So hematocrit will increase and there will be reduction in platelet count. So these are the warning signs. If they are present, then it is known as non-severe dengue with warning sign. Now lastly, severe dengue. What is severe dengue? Severe dengue may be a case of severe plasma leakage leading to dengue shock syndrome or fluid accumulation with respiratory distress, severe bleeding which may be manifested as a DIC, disseminated intravascular coagulation leading to severe bleeding, or there may be severe organ involvement, okay, liver involvement, CNS involvement, heart or other organ involvement. So organ involvement, severe bleeding, severe plasma leakage, these are the sign of severe dengue. So this is the new classification of dengue by World Health Organization or WHO. Now how a classic dengue patient will present? Okay, I have also told you that this is also known as breakbone fever. There will be abrupt onset, that means sudden onset. Okay, patient will have chills, headache, retroorbital pain, which is very important. Patient will complain of pain behind the eyes, okay, and there will be severe backache. So headache, retroorbital pain, backache, bony ache, all this will be there. The onset will be abrupt. Okay, the fever is also known as saddleback fever, biphasic. That means the fever will have a peak, then it will settle down, and then again there will be a peak. So saddleback pattern. Fever lasts for 5 to 7 days usually. Okay, there will be rash, presence of rash which may be centripetal. Palm and soles are usually spared, okay, and the rash lasts for 1 to 5 days and it dissolves with desquamation. Okay, there may be myalgia, that is muscle ache, arthralgia, there is joint pain, anorexia means reduced appetite. There may be relative bradycardia. What is relative bradycardia? Normally with every 1 degree rise of temperature, there will be increase in heart rate by 10 beats per minute. Okay, but in case of relative bradycardia, with increase in temperature the heart rate will increase, but not in this particular ratio. The increase in heart rate will be less than 10. So this is known as relative bradycardia. In dengue we get relative bradycardia, and one more condition, enteric fever also we get relative bradycardia. There may be bleeding and lymphadenopathy. So these are the manifestation of classic dengue or breakbone fever. Dengue hemorrhagic fever, how does it manifest? It is more common among older children. Okay, there will be acute onset of minor or major bleeding, platelet will be low. There will be plasma leakage, and because of plasma leakage there will be effusions. There will be pleural effusion, no? Okay, then pericardial effusion. Serotype 2 is more potential to cause dengue hemorrhagic fever. Fever stays for 2 to 7 days, and patient usually develops shock during 3rd to 7 days. Okay, commonest hemorrhagic feature will be demonstrated by tourniquet test. Okay, so this is how a dengue hemorrhagic fever presents. As the name suggests, hemorrhage, so there will be minor or major bleeding, and it is most commonly seen in older children. And just remember that serotype 2 is more potential to cause dengue hemorrhagic fever. Now, as I was telling that the hemorrhagic manifestation can be demonstrated by a tourniquet test. So what is a tourniquet test? Okay, in tourniquet there is an image you can see. In tourniquet test we need to apply the blood pressure cuff, okay, and we need to mark a circle with an area about 2.5 centimeters square, roughly the size of the diaphragm of a stethoscope. Okay, in this area, okay, in this area we have to mark a circular area. Then we need to inflate the cuff to a point. Okay, we need to inflate the cuff to a point midway between the systolic and diastolic pressure, and we need to maintain that inflation for 5 minutes. Now a test will be considered positive when 20 or more petechiae appear in this circle. So this is the image, this is the positive tourniquet test. That means you need to apply the blood pressure cuff out here, and then you need to inflate the cuff in between systolic and diastolic blood pressure, midway between systolic and diastolic blood pressure, and then you need to apply the pressure for 5 minutes. After 5 minutes you see the circular area you have mentioned in the circular area you have marked in the antecubital fossa, and then if you get 20 or more petechiae spots, then the test is positive. That means that the patient is at high risk of development of hemorrhage. Okay, dengue hemorrhagic fever. Now diagnostic criteria for dengue hemorrhagic fever, all 4 of the following criteria has to be present. Patient should have fever. Okay, as the name suggests, dengue hemorrhagic fever. So patient should have fever, patient should have hemorrhagic tendency, there should be thrombocytopenia and plasma leakage. So fever, hemorrhage, thrombocytopenia, plasma leakage. Fever or history of fever should be there for 2 to 4 days. Hemorrhagic tendency is manifested by tourniquet test, just now I have mentioned. There may be presence of petechiae, chymosis, purpura, mucosal bleeding, GI bleeding. Thrombocytopenia should be there. Plasma leakage feature should be there. What are the feature of plasma leakage? How do you know there is leakage of plasma? If there is increase in hematocrit by 20% or reduction in hematocrit after using intravenous fluid, or if there is pleural effusion or hypoalbuminemia, these are the sign of plasma leakage. Again I am telling you, how do you know there is plasma leakage? There will be increase in hematocrit. From the baseline it will increase by 20%, or there will be decrease in hematocrit by 20% if you give intravenous fluid to the patient. There will be pleural effusion and hypoalbuminemia. So these are the signs of plasma leakage. 1, 2, 3, 4. So all these 4 criteria should be present for a patient to call it as dengue hemorrhagic fever. Lastly, dengue shock syndrome. As the name suggests, shock. So the patient will have all the features of dengue hemorrhagic fever, the 4 features just now I have mentioned. Along with this, the patient will have shock. That is why it is known as dengue shock syndrome. There is circulatory failure because of shock. Patient will have hypotension, tachycardia, sweating, shortness of breath. Warning signs in dengue shock syndrome are intense abdominal pain, persistent vomiting, restlessness and lethargy, hypothermia with sweating. So these are the Warning signs in dengue shock syndrome. Coming to the diagnostic criteria of dengue shock syndrome, all the 4 points of dengue hemorrhagic fever has to be present, plus there should be features of shock or circulatory failure like tachycardia, increase in pulse rate, narrow pulse pressure. What is pulse pressure? Pulse pressure is the difference between systolic and diastolic blood pressure. Okay, this is pulse pressure. So pulse pressure will become narrow because of shock. The systolic blood pressure will go down, so there will be a narrow pulse pressure. Hypotension, when do you call it as hypotension? If the age is below 5 or below 5 and the systolic blood pressure is less than 80, and more than 5 years systolic blood pressure less than 90, cold, dry skin and restlessness. So these are the features of circulatory failure. Along with the features of dengue hemorrhagic fever, if the patient has features of circulatory failure, we call it as dengue shock syndrome. So we have known about classical dengue fever, dengue hemorrhagic fever and dengue shock syndrome. Okay, now how do you diagnose the dengue fever or dengue virus? Detection of virus, up to 5th day it is possible virus is present in serum. Serology can be done. Detection of NS1 antigen is important. ELISA, by ELISA we can detect IgM antibody. Okay, rising titer is more sensitive. RT-PCR is done, sensitive and specific. Okay, so serology, NS1 antigen, IgM antibody detection and RT-PCR. So this is how we diagnose a case of dengue fever. Lab findings, we know there will be thrombocytopenia and there will be hemoconcentration. We have already talked about. Platelet will go down and hematocrit will increase. So there will be hemoconcentration. There will be reduction in total count, reduction in neutrophil, relative lymphocytosis will be there. LFT will be deranged, there will be raised PT-INR because of deranged liver function. Okay, differential diagnosis, it should be differentiated from malaria, leptospirosis, hepatitis, chikungunya, sepsis, rubella, influenza and meningococcemia. So these are the differential diagnosis for a case of dengue fever. Lastly, the most important part, treatment. Now, just to mention that there is no specific medication for a dengue infection. The main treatment is symptomatic and supportive. So, always remember that the treatment of dengue is always symptomatic and supportive. So, fever, if there, you give paracetamol. Close monitoring is important. If the patient is having plasma leakage leading to shock, you need to give plasma expanders, isotonic solution, proper nutrition to be maintained. So what? Look at the patient's symptoms and try to give symptomatic relief and supportive care. Now, how do you give fluid to a patient who is having dengue shock syndrome, hypotensive shock? Okay, try to obtain a hematocrit level before fluid resuscitation. Start with isotonic crystalloid or colloid can be given. If there is improvement, yes, okay, then IV crystalloid or colloid at a rate of 10 ml per kg per hour for 1 hour you give, and then you reduce gradually the dose of IV fluid. Okay, once the clinical improvement is noted, stop IV fluids at 48 hours. That means you start giving IV fluid, crystalloid or colloid, then you keep on reducing the dose, and if the patient remains clinically improved, then you can stop giving IV fluid at 48 hours. Okay, but after the first bolus of isotonic crystalloid or colloid, if there is no improvement, you look for the hematocrit again. We have already looked for the hematocrit in the baseline. Now again look for the hematocrit. If the hematocrit has decreased, then severe overbleed is there or not, just see. If it is there, then you need to give blood transfusion urgently. If there is no severe bleed, then you can give colloid. Blood transfusion can be given if there is no clinical improvement with colloid. Now, if there is no improvement and the hematocrit is high, still high, then you give IV crystalloid or colloid second bolus over 30 to 60 minutes. If there is improvement, then reduced IV crystalloids. Okay, then you follow the same protocol which you have followed, like we need to reduce the IV fluid and stop fluid at 48 hours. Okay, so this is the management flow. How do you manage a case of dengue shock syndrome? How do you give fluid and how do you check for hematocrit and all? Okay, so this is about the management of shock, hypotensive shock. Now, management of hemorrhagic complication. If there is mucosal bleeding, If the patient remains stable with fluids, it should be considered as minor bleed. Okay. If there is profound thrombocytopenia, what care we need to give to the patient? We need to protect the patient from trauma. We do not give any intramuscular injections. Okay. Prophylactic platelet transfusion has no proven benefit. Okay. We can give 5 to 10 ml per kg of fresh packed red cell or 10 to 20 ml per kg of fresh whole blood. Okay. So this is what we do if the patient has profound thrombocytopenia. Okay. We protect the patient from trauma, no IM injection, no platelet transfusion. It has no prophylactic platelet transfusion. We can give packed cell transfusion and fresh whole blood transfusion. Lastly, complications. What are the complications may arise because of dengue fever? Bleeding, as I have already mentioned, there will be disseminated intravascular coagulation, DIC, which ultimately leads to severe bleeding. There may be ARDS, acute respiratory distress syndrome. There may be renal failure, hepatic failure, and CNS manifestation in the form of encephalopathy. So these are the complications which may arise from dengue fever. Most of the time, dengue is not so serious. Dengue does not become so serious, but for certain cases, the patient really develops dangerous complication, which if not attended, the patient may die also. That is why dengue is a very important disease and which we really need to know about. Lastly, prevention. We always know that prevention is better than cure. Okay, so we really need to prevent dengue infection. So how we can prevent dengue infection? The first and foremost thing we can do is mosquito control. We can use mosquito repellents. We should try to avoid the mosquito bites. Okay, just to mention that the mosquito Aedes aegypti, it's a daytime biter. It usually bites just after the sunrise, for few hours it remains very much active. Okay, so it's a daytime bite, it bites at daytime mainly. Okay, and very importantly, it bites, okay, near the ankle and near the elbow. Okay, so mosquito control is very important. Use mosquito repellents, use cloths which covers your limbs, and then you should use mosquito net. You should use mosquito repellents at home. A vaccine is to prevent dengue is licensed and available in some countries for people aged from 9 to 45 years. But WHO, World Health Organization, recommends that the vaccine should be given only to people who had previous dengue virus infection, confirmed previous dengue virus infection. So this is about the prevention which we need to keep in mind. So thank you so much for attending the class. I hope it is helpful for you. It will be helpful. Thank you so much.